Good morning, denture peeps. Let's talk about sleeping in your dentures. So, I've been doing this for decades. I am a denturist. My name is Kismet, and this is what I tell my patients, okay? And keep in mind that every patient is different, and each provider will have their own philosophy. Here's mine. So, I get that question all the time. Can I sleep in my dentures? Should I take my dentures out at night? What do I do? Okay, so it's case dependent for each patient. So I've seen patients who do not like to sleep in their dentures. They want to give their mouth a chance to rest, and that is perfectly okay. I've seen patients that say, I cannot take my dentures out at night because I wake up with the worst jaw pain in the morning. So I've told them that you can sleep in your dentures. Here's the crux. If you're going to sleep in your dentures, you need to clean your mouth thoroughly. You need to clean your dentures thoroughly. There are potential risks with sleeping in your dentures. There are studies that have shown that there's an increased chance of aspiration pneumonia with patients who sleep in their dentures. Typically, those studies have captured patients who are in an acute care hospital situation or in a long-term care facility, and they are not getting the oral care that they're needing. Okay, so nobody's helping them and cleaning their dentures, cleaning their mouth, and so they are going to bed with filthy dentures and food debris in their mouth and bacteria in their mouth, and usually they're in a hospital bed, or they're in their own bed sleeping, and at night, that saliva with all that bacteria, all of the food debris, all of that, they can aspirate that into their lungs, and it can cause aspiration pneumonia. So with that said, this is what I tell my patients to do. If you need to sleep in your dentures, which some patients do, some patients have TMJ, or it just hurts to go without their dentures. In the middle of the night, their jaw is closing too much and it's putting pressure on that temporomandibular joint or the muscles of their cheek and their jaw. So they have to sleep in their dentures. So I tell them, clean your mouth thoroughly, clean your dentures thoroughly before you go to bed each night if you're going to sleep in them. If you're not going to sleep in them, that's a great time to soak them in your favorite denture cleaner. And that's my take. And I have been doing this for decades. My parents did this for decades before I started doing it. And we have followed cases for many, many years. So I saw a lady on here. She's not a licensed dentist or denturist, but she was saying that, absolutely not. Do not sleep in your dentures. The denture expert's wrong. And, I've seen patients have hamburger meat for gums from sleeping in their dentures. Okay, so first of all, unless you are a denturist or a dentist or a doctor, somebody with, that kind of expertise and licensure behind your name, then you should be deferring to that provider, the dentist or the denturist. Oral pathology is a very serious situation, and if you are seeing somebody's gums looking like hamburger meat, that is very alarming, and I hope that you referred them over to see the dentist for that. I am certified to identify oral pathology as a part of my licensure and refer them to the proper provider, which would be the dentist. Having something that looked like hamburger meat, it's very possible that that patient could have denture stomatitis, which is caused by an ill-fitting denture. Not just a denture, but an ill-fitting denture. If you are wearing an ill-fitting denture and that is moving around against your gums, that can cause denture stomatitis. It is also something that could be due to yeast. It could be due to leukoplakia. It could be caused by some sort of infection or medication side effect. It could be caused by possible cancerous cells. So I really hope that those auxiliary provider assistants in that make sure that when they see something like that, they refer them to an actual, licensed provider to take care and evaluate that. So with that said, have a great day. Bye.